The situation at the Princess Margaret Hospital has reached a boiling point. That's according to President of the Bahamas Doctors Union, Dr. Millicent Bassett, who claimed the hospital has no space left to isolate suspected COVID-19 patients. Scores of doctors and nurses attached to the Accident and Emergency Department removed themselves from the facility on Tuesday as they called for the situation to be rectified.
This morning, we are at a tipping point where our staff members have become compromised because of the overwhelming number of patients with suspected COVID symptoms presenting to A&E. As it stands, all of our isolation rooms are occupied. And we need additional rooms, additional spaces to account for the number of patients that we are seeing on a daily basis.
Cases of COVID-19 have exploded in recent weeks. 575 cases have been confirmed in the last month alone, and with teams of doctors already out of the system due to exposure, Dr. Bassett said doctors are not satisfied that enough is being done to mitigate against further risk.
Now, our staff is concerned and being compromised because we have those patients under investigation on the floor. So today, they have removed themselves because of the risk to themselves and their families if they contract COVID-19. Not only that, they are speaking for the patients who have been waiting without proper assessment because there is no place to assess them.
Last week, the Public Hospitals Authority announced a reconfiguration of its wards at the Princess Margaret Hospital, Sandilands Rehabilitation Center, and the Rand Memorial Hospital on Grand Bahama following an increase in the number of persons presenting to hospital and staff testing positive for COVID-19, which has put a significant strain on resources, including bed capacity. The statement read, quote, "The current exposure of employees and patients across our hospitals is being managed subject to international infection prevention control guidelines for infectious outbreaks of this kind and the policies of PHA." The statement continued, "The normal process follows that contacts, patients, and employees are screened, tested, quarantined, or isolated subject to the presentation of symptoms. Every effort is being made to mitigate the spread of COVID-19 within our institutions." End quote. Despite the reported shift, Bahamas Nurses Union President Amanda Williams said nurses remain concerned not only for themselves but also for their families.
The second surge is to the max. So now you have to come up with a different plan. And that involves the nurses and the doctors who are going to carry out the strategic plan for this Commonwealth of the Bahamas so that we can save lives.
Williams said Grand Bahama nurses are also facing serious challenges. According to her, last week, 16 nurses on Grand Bahama were quarantined and 6 tested positive for COVID-19. She would not say how many New Providence nurses had been impacted.
This is no joke. And you sit down and you don't want to hear from the presidents. We're trying to work with you, but you're not trying to work with us. Staff is being compromised. The building is falling apart. Raining. You're putting up buckets. In the parking lot, no light. You're treating the staff. They're going to get frustrated.
Reporting for Guardian News Network, I'm Jasmine Brown.